one of the key questions is, if you run the world and you don't want competition, how do you shut down people's consciousness? How do you do that? Well, you put poisons effectively into the water supply that compromise these gateways of consciousness. And fluoride is one of the most powerful poisons that is routinely used for this purpose.
The pineal gland is actually kind of located in the center of the brain, and it secretes two hormones, DMT and melatonin. Melatonin actually regulates your sleep cycles, and it's kind of like a feel-good hormone, which also helps regulate your puberty, and it helps regulate all your hormone structures inside your system. The pineal gland to me is so important because it's been regarded as like the third eye, and even in Egyptian times they call it the eye of Horus. They call it the pineal gland because it kind of resembles a pine cone. And if you look at the staff that the Pope has, it has a pine cone on it. And if you look at statues throughout the Vatican and throughout history, you'll see the shape of a pine cone, and you'll see symbols showing the importance of the pineal gland. Now, the pineal gland is also regarded in some religions as the seat of the soul, or it's your gateway or your connection to God. If you know that the pineal gland is the consciousness of the human, and that could be your connection with God, why not take it out? And the fastest and easiest way to take out the pineal gland and to calcify the pineal gland would be with fluoride, because fluoride has an affinity for those areas in the body that produce calcium hydroxyapatite.
Today in the United States, children are reaching puberty much earlier in age than they did in the past. Some evidence indicates that fluoride, via its effect on the pineal gland, could be a contributing cause to this trend.
In 1997, Jennifer Luke published her PhD thesis on fluoride in the pineal gland.
In her dissertation, she conducted animal studies and concluded that fluoride exposure has been found to cause early puberty in females. Similar findings have been reported in 2 epidemiological studies of human populations that are drinking fluoridated water. The first study was conducted in 1945 during the Newburgh versus Kingston fluoridation trial. It was discovered that girls in fluoridated Newburgh were reaching menstruation on average 5 months earlier than the girls in unfluoridated Kingston. But the result was not thought to be significant at the time. In 1983, another study was conducted in which a man with the last name of Farkas reported that girls living in highly fluoridated towns began their first menstruation cycles at a much younger age than girls living in less fluoridated areas.
When the pineal gland is calcified, it causes an onset of puberty. In my documentary, Crippling Waters, one of the ladies in there, we called her the star, a 9-year-old girl. Take a look at her. Does she look 9? She's exposed to high fluoride in her family's well water. Her dad, who's only 20 years older, is starting to bend over like this and starting to become crippled. He can't put his hands above his head. The calcification of the pineal gland is an adaptive process so that that child can have babies by the time she's 14, because she's going to be crippled by the time she's 40.
Fluoride's role in earlier puberty needs more thorough investigation. When one considers the seriousness of a possible interference by fluoride on a growing child's pineal gland, it underlines the negative and dangerous effects of fluoridation.
Dave, so what we're learning is kind of frightening, because it seems to me that once it's in your body, is it there to stay?
Yes, you can't get it out. You can cut some of the harm by mitigating the damage and avoid it like the plague, but you really can't get it out because it's stuck in your bones. And that's why you have all the skeletal symptoms, you know, the joint pain, the arthritis, and all that stuff.
The first signs that fluoride is poisoning your bones is pains in the joints, stiffness in the joints, pains in the bones.
Well, you go to the doctor with pain in a joint, he says, oh, you got arthritis. Well, arthritis, joint, ritis, pain, oh, okay, joint pain. So we got somebody speaking to us in Latin, oh, you got joint pain, super duper.
We have millions of people with arthritis in the United States and in fluoridated countries, 1 in 3 adults. Nobody's ever looked to see if some of those arthritis cases may have been caused or exacerbated by fluoride. Just not looking.
Are bones with more fluoride stronger or less strong? And the answer is less strong. And they got studies where they tried to give them a dose of fluoride, sodium fluoride, to cause an increase in bone mass. It did, but it weakened the bone itself. So those are case-controlled studies. That's the gold standard in medicine. So we have case-controlled studies showing that if you give people fluoride, it accumulates in their bones and it causes the bones to become white, opaque, increases the bone density, decreases the bone tensile strength. And they actually took bone that was removed from people for the purpose of replacing a joint or a hip, put it in a little device here where you put a weight on there and snap it, and they showed that the more fluoride in the bone, the quicker it snaps.
If you ever wonder, how come everybody has hip replacements, knee replacements? I mean, you can go on and on. I can think back when I was a kid, that didn't happen. You didn't see all these crippled people. I mean, you saw a few, but it wasn't common.
I mean, how does it end up in our bones? Is it that where our body just finds?
It's calcium-rich tissue, so your body parks it there because it's got to dispose of it some way, otherwise it would kill you. So it parks in the bone, and then it kills your bones.
What it does once it fills up with fluoride, that you get little spikes on the outside of the bone. If you take a hand and take a bone and run your hand up and down a normal bone, it's slick, and that's because muscles move around on the bones when you're running or jogging or lifting weights and all that stuff. Your muscles are moving around on your bone, and it's slick, so it doesn't hurt. Well, if you make that bone the texture of sandpaper, then when the muscle moves around, the fascia tears, and it hurts to move. And so fluoride accumulates in calcium-rich tissues, which are bone, ligaments, cartilage, joints, and teeth. So you have to look at this as if you have a lifetime body burden, and the less you're exposed to, the longer you can go before you develop symptoms. The first most irrefutable symptom of fluoride exposure is pain. And that's what we saw. My wife and I filmed a documentary in China. And pain was the hugely significant symptom that they all had. They couldn't even work. And you know, in China, if you don't work, you starve to death.
Have you ever heard of dental fluorosis?
No.
No.
It comes when somebody's overexposed to fluoride.
Awesome.
That's a picture of very mild dental fluorosis. And so is that. You know, that young girl came to see me to get that fixed because she doesn't think that's beautiful. She thinks that looks bad when she smiles. And I think everybody else agrees with her.
They say 41% of American teenagers have this condition.
So this is a white spot, so it's been there. It's a little scary, you know, knowing that many people, we don't even know, what's in our water.
Fluorosis can become more severe than a simple white spot. In severe cases, it can deform a patient's teeth.
When you see spots on the teeth like this, that means you gave the child enough of a poison that the cells that were making that organ didn't make it right. They made it wrong.
When I was a child, I was overexposed to fluoride. There are streaks of that in my teeth.
So you learned that early on then?
I knew, yes. Those teeth are very brittle, and so I have cavities more frequently in those teeth than other ones that don't have the evidence of the fluorosis.
Maybe you've seen it. It's white, chalky spots on your teeth.
And I was told that those are calcium buildups.
From the fluoride.
Okay.
I don't think I had really, really strong teeth to start with, but I did have some teeth that they just broke. The last time this happened, I was eating a baked potato, and it broke two out.
Baked potato.
A baked potato, and it broke two out.
Did you notice anybody else in the plant losing teeth?
Yeah. We talk about it a lot at the plant.
So the ADA, the people in office, the people who are in these regulatory agencies, they're aware of overexposure to fluoride causes dental fluorosis, correct?
Yeah.
They know of that, right? And they know that dental fluorosis, the teeth become weakened, they chip, they fall out.
Brown, spotted, ugly, wear away real fast. Yes, they know all of that. We took California, we took the whole state. There's no difference in dental care costs for welfare from one end of the state to the other, regardless of the amount of fluoride in the water, whether it's 0.1, 0.2, 0.3, no difference. So if there was a tremendous benefit, you ought to be able to see that, and it doesn't show up at all in the computer data. So that's why they won't debate you.
And although fluoride can help with your teeth, If either chemical is consumed in high amounts over a lifetime, it can lead to cancer, skin conditions, bone disease, and other health issues.
There is a recent lawsuit in Maryland, it's a federal lawsuit, a woman who believed the medical establishment at the time when her daughter was an infant. She gave her daughter 90% of her diet, intake of water was this fluoridated baby water. And so the daughter grew up with severe fluorosis, and to get that corrected, dental restoration is about $100,000, and they can't bear that burden. So they are suing Nestle and Gerber.
So putting it in a baby bottle when the child doesn't have any visible teeth, there's no way on God's green earth that can have anything except a negative impact on that child. It will damage that baby's teeth.
But they sell it in the grocery store as baby's first water. I've seen that for years. How do we educate women to not buy this for their babies?
And this is why we wanted the warning for infants, because they're the most at risk. They drink their weight in water within 2 or 3 days. If you and I did that, we'd be drinking 22 liters a day.
I mean, it just goes back to the whole, these regulatory agencies that are supposed to, be kind of looking out for our best interests, and as you know, they're not.
There's no reason for the FDA to allow them to sell this as a food. It's a crime. I hope they're punished someday. I say they have a duty to warn. They have a duty to warn you. Not one manufacturer of formula says, by the way, don't use the tap water. Women, infant, and children, WIC program. We contacted them. They refused to tell mothers not to use the tap water. And you know what she said? It would damage the fluoridation program.
Fluoride is safe and effective, and it's one of the most inexpensive ways to really cut down on dental decay. Fluoride is safe and effective. Fluoride is safe.
Fluoride is safe and effective.
Well, there's a study from 20 years ago showing infant mortality was higher in fluoridated communities. Is that why? I don't know. Why didn't they do a follow-up study? I think that would be interesting to know.
Children have died, you know. There's been a case of a child who swallowed this. The dentist left the room. The parents didn't know. The kid swallowed it, had to be rushed to hospital. They couldn't save him. He died. So yeah, it's very toxic substance. There's no question about that.
Is that the kind of stuff that a responsible parent would be putting in their child's hand? FDA in 1997 required manufacturers of toothpaste to put this warning label on it. It's the same as you'd have on a loaded .38 caliber pistol. Keep out of reach of children. And only use a little pea-sized amount, which is about the same amount that would be in a bottle of water. And if that amount is swallowed, call the Poison Control Center or seek professional help immediately. So if I drink a bottle of water, should I call the Poison Control Center too? This is just insane. So this is what 2 different organizations say. One says, don't swallow it. Why did they put that on there? They put that on there because there were 10,000 calls a year to the Poison Control Centers from children made ill by swallowed toothpaste. 10,000 calls, and you know for every call there's 5 that didn't call. And there are only Poison Control Centers in half the states. So that means 100,000 children are made ill by swallowed toothpaste. It's insane to put a deadly poison in a child's hand and say, go brush and be sure and spit out, Johnny.
Fluoride has been a slow process of introduction into the dental profession, where it's commonplace for us to consider fluoride as the thing to do to help decay. But we now know, statistics have shown us, that fluoride is not working. It's very toxic to you and can cause everything from cancer to depression. So yeah, it's a serious issue.
You are meant to have the right to informed consent to medication. What we're doing in a fluoridated community is we're doing to everyone what a doctor can do to no one. A doctor says to you, he says, look, this glass of water is going to do wonderful things for you. It's going to cure your ingrowing toenails. It's going to make you less bald. It's going to do X, Y, and Z. Drink it. And you say, no, I don't want to drink it. You must drink it. You've got to drink it. I'm your doctor. I'm telling you, you've got to drink it. If he or she tried to do that to you, he or she could lose their license. You're not. You've got to tell the patient what the drug is good for. You've got to tell them what it's bad for, the side effects. And then they, in theory, make up their minds. This has been ripped away from us.
Water fluoridation is the dispensing of a drug.
This is not chlorine. This is not any number of the other chemicals that are used to treat the water.
Fluoride is being put in specifically to alter you physically, to make a physical change in you.
Fluoride is a drug, is a medicine.
This is the only thing anywhere in the world that gets added to the municipal drinking waters to actually treat the human.
Well, anytime you see the letters FLUO, you're talking fluoride.
And so when you start realizing that Prozac is a fluoride product, Zoloft is a fluoride product, virtually all of your psychotropic drugs, almost all of those that are mood elevators. And one of the reasons being is because it has this tremendous capacity to affect serotonin. Serotonin being the chemical that goes from one neuron to the other brain neuron. And so when we looked at the selective serotonin reuptake and when basically an inhibition of the serotonin to be taken up, that's the fluoride that's doing that.
Prozac is fluoxetine. It's a fluorinated psychoactive. Matter of fact, almost all your psychoactive drugs are fluorinated drugs. They put it in there both as a carrier and an accelerator of the effect.
The actual active ingredient in Prozac is fluoride.
Prozac is made almost entirely from fluoride molecules. It is, like SSRI drugs, are similar molecularly to some of the elements in fluoride. Remember the school shootings in Columbine, Colorado? Yeah. They were on SSRI drugs. Those drugs make your mind think that you're not living in the real world, that you're actually just sort of experiencing a false reality. And I think fluoride has much the same effect.
There's tons of products that are pharmaceutical products that, in some cases, the fluoride is just being used to what I call potentiate it, to actually make it a stronger one. Fen-Phen, which was the diet drug that was taken off the, well, why did they take it off? Well, fenfluramine, you can hear the fluoride part in there. The fenfluramine was the part that actually made the thickening of the heart valves so that they pulled off. Amazing part about it is Rohypnol, the date rape drug. A lot of people just call it that.
The roofie.
Okay, yeah,
right?
Roofie. Yeah, and so what does that roofie do? Basically, it causes an anterograde amnesia. Well, okay, that's a fluoride product, so how does it do that? Well, we probably should have guessed that it would do that already anyway, because if you went in and had surgery, general surgery right now, knock on wood that you don't have to ever do that, but if you were, they would give you 4 molecules of fluorine and 2 of bromine and 1 of chlorine, and that's what knocks you out during that time. So the truth is that when you start looking at all the pharmaceutical uses for it, that it's just amazing all the things that that are around us all the time that we didn't recognize or that we didn't see.
There is absolutely no drug on the market that's given in a one-dose-fits-all situation.
We don't put other things in the water to try to keep everybody's blood pressure down or everybody's stroke risk down. And there's no reason why we should be trying a one-size-fits-all approach for this either.
Once you put a medicine in the drinking water, you can't control the dose because you can't control how much water people drink. You can't control who gets it, it goes to everybody. If you ask a pharmacist if there's any drug in his store that was safe enough to give to everyone, young people, old people, sick people, people with poor nutrition, give it to them in any dose, they'd laugh at you. It's ridiculous.
There's no way you can give out a medicine without being able to control the dose. And one dose cannot fit all, and you can't give a medicine to everybody. You are forcing it on people who don't want it. There are people in this audience who've spent far more time researching this issue, including David, myself, and many other people in this audience, and they've stated categorically to the mayor, to the city councillors, we do not want you to force this medicine on us. We have the right to informed consent to medication. That's a very important right. This is a violation. It's being violated every day in this country to over 200 million people.
There needs to be informed consent. We have that with all other medications. When we go to the doctor, he or she gives us the information of what the side effects are going to be. With fluoride, there is no informed consent. There is no safe dose for this one-size-fits-all medication that they're doing to us.
Now, all of those issues are important, but the one that really concerns me is the impact of fluoride on the brain.
A study panel for the EPA listed fluoride